In the mid-1960s, a physician named H. Jack Geiger began writing prescriptions for food for his patients in the Mississippi Delta. He argued that nutritious food was the intervention he knew was recommended for malnutrition. In some sense, this was one of the first community health interventions in the United States, operated out of the country's second community health center. While community health interventions have been around for decades, in recent years there's been a renewed emphasis on them and a rethinking of how to make them more effective in terms of improving population health. Community health interventions are not directed primarily at healthcare services. Rather, they are aimed at helping patients address their social, financial, and behavioral issues that can adversely affect their health outcomes. Historically, many community healthcare worker programs failed. They have often been ineffective in achieving their goals and do not improve the health and healthcare outcomes of their patients. Yet we still think that community health interventions are incredibly important. Why is this? Well, in large part because they are aimed at addressing the social determinants of health, which we know are important for improving health outcomes for certain populations. Social determinants of health are non-medical issues like housing, transportation, food, or social connections that contribute to good health or, when they're absent, may cause health problems. Take as an example a patient coming into the emergency room with a gunshot wound. The hospital can treat that wound, but they may send the patient home to a dangerous neighborhood where they may not have the resources to get the medication or food they need to recover. The patient might have missed work to go to the emergency room. Suddenly, they're out of a job. Their health might continue to decline. If they have few social supports, they might become depressed. What social determinants recognize is that healthcare issues don't occur in isolation, separate from the entire life of a patient, but they occur in a social, familial, employment, and community context. And sometimes to effectively address health problems, we need to address the social, familial, employment, and community issues that arise in patients' lives. So paying attention to social determinants of health is not peripheral to medical assistance. It is crucial to making sure that medical interventions actually work effectively. This is where community health interventions can have a big impact. Well-implemented interventions pay attention to both social and medical determinants of health. When a patient comes into contact with the medical system, for example, when they're admitted to the emergency room, they can be matched up with a community healthcare worker. This worker can facilitate communication between the patient and their medical team, making sure everyone is on the same page about what care is needed and how it should be delivered. They can also link up patients with social service resources that they might not have been aware of or had the wherewithal to go through the application process. Maybe they help the patient with housing assistance or applying for SNAP, that is food stamps, or getting heating assistance for the winter, or connect them to a religious community, or get exercise at a YMCA. Once a patient is discharged, the worker can make sure that they have everything they need. Medical devices are at home, prescriptions are filled, transportation is provided home, and that they can follow up with their doctors and make sure that they're actually going to their medical appointments. By checking in frequently, the worker can ensure the patient is getting support at home and is not socially isolated as well. But to be successful, community health worker programs need structure, organization, oversight, and evaluation metrics. Indeed, the successful programs standardize interactions and interventions with patients, and they focus on hiring the right people with the right interpersonal skills and problem-solving abilities. Like any kind of successful program, these community health worker programs require very specific attention to all the details and steps involved in getting patients care. These community healthcare worker programs have the potential to make real changes in the lives of patients who need them. By focusing on both medical and social assistance, community health workers are able to address the underlying causes of health problems and work with patients to minimize their future health issues and therefore potentially save money and improve health outcomes.